The tragic passing of Betsy Arakawa, wife of renowned actor Gene Hackman, has cast a spotlight on a rare but devastating illness, Hantavirus pulmonary syndrome, HPS. While authorities confirmed Mr. Hackman's death from heart disease, Mrs. Arakawa's death underscores the urgent need to understand this often fatal condition. This isn't just another news story. It's a stark reminder of the hidden dangers lurking in our environment and the importance of awareness. What exactly is hantavirus pulmonary syndrome? HPS is a severe viral infection, rarely encountered but undeniably dangerous. It's a sneaky adversary, capable of inflicting significant damage on major organs, primarily the heart and lungs. The disease progresses with alarming speed, often leading to a devastating outcome if left untreated. The Cleveland Clinic, a leading medical institution in the United States, describes the progression as rapid and potentially fatal, highlighting the urgency of early diagnosis and intervention. The insidious nature of HPS lies in its origin. Hantaviruses, the culprits behind this illness, cause two distinct syndromes, HPS and hemorrhagic fever with renal syndrome, HFRS. While HFRS presents with different symptoms, HPS focuses its attack on the respiratory system and other vital organs. The transmission route is equally unsettling. Exposure to infected rodents is the primary pathway of infection. This isn't about simply encountering a mouse. The danger lies in inhaling, ingesting, or otherwise contacting the droppings, urine, or saliva of infected rodents. This isn't a hypothetical threat. While not every rodent carries the hantavirus, specific species are known carriers in North America. Deer mice, white-footed mice, rice rats, and cotton rats have been identified as vectors, underscoring the importance of practicing caution in areas where these rodents are prevalent. The seemingly innocuous act of cleaning up after a rodent could have life-altering consequences. The virus doesn't discriminate. Exposure can occur in rural or urban environments, highlighting the widespread potential for infection. Despite the severity of HPS, the good news is that it remains relatively rare in the United States. Data from the Centers for Disease Control and Prevention, CDC, reveals that between 1993 and 2022, a total of 864 cases were reported nationwide. This low incidence, however, doesn't diminish the seriousness of the disease. The fact that such a rare condition can cause death underscores the unpredictable nature of viral infections and the need for continued vigilance. Geographical distribution also offers valuable insights. The data indicates a clustering of cases in certain regions. New Mexico, with 122 reported cases, holds the unfortunate distinction of having the highest number over the 3-decade period. Colorado follows closely behind with 119 cases. This geographical concentration points to environmental factors that might influence rodent populations and, consequently, the risk of hantavirus transmission. Understanding these patterns is crucial in developing targeted prevention strategies and improving public health initiatives. The death of Betsy Arakawa serves as a poignant reminder of the unseen dangers that exist in our world. While HPS remains a relatively rare illness, its potential for severe complications and fatalities cannot be ignored. Awareness is our first line of defense. Understanding how hantavirus is transmitted, identifying high-risk areas, and practicing appropriate safety measures are vital in preventing future tragedies. The story of Betsy Arakawa isn't just a tragic tale. It's a call to action, urging us to take proactive steps to protect ourselves and our communities from the hidden threats in our environment. This rare but serious illness demands our attention, not just as a medical curiosity, but as a potential risk we all must consider. The memory of Mrs. Arakawa serves as a stark reminder of the importance of understanding and preventing this devastating disease.